And I would like to thank the organizers and Dr. Samar for the kind introduction as well. So in this talk, I'm going to cover a few important aspects related to how we approach weaning, as we normally say, or complementary feeding, as is the official word for it. I'll also be covering a little bit about picky eating, as it refers to the weaning stages. When we discuss complementary feeding, I mean, nothing comes higher than exclusive breastfeeding. So the World Health Organization recommendation is to give exclusive breastfeeding for the first 6 months of age. Thereafter, we have to start complementary foods and continue breastfeeding up to 2 years and beyond. So the key is to start with breastfeeding, stay with exclusive breastfeeding as far as you can. 4 to 6 months, as we will discuss in the further slides, and we have to continue breastfeeding up to 2 years and beyond. So the main nutritional requirements we need to get is basically protein for growth and repair, carbohydrate which is needed for the energy release, the neural maturation, as well as glucose as immediate source of energy for most of the functions. And lipids, of course, have a high energy release ratio, and so we need them to have the protein sparing function. And lipids are essential for the nervous system maturation, the myelination. We have iron, which is very important in preventing anemia, and the impact of deficiency is significant on cognitive development in early infancy. In vegetarians and vegans, B12 deficiency can be an issue, and this should be a consideration. Other vitamins are also important, and minerals like calcium, zinc, and iodine are important as well. So we have to have a balanced diet with all these essential components. When we talk of complementary feeding, we can refer to addition of foods other than milk to the diet of young infants, usually at a stage when the milk alone is not adequate to meet their requirements. So even though the infant formula is a type of complementary food, when we consider exclusive breastfeeding aspect, we don't normally refer to formula feeding, we call it mixed feeding. And when we say weaning or complementary feeding, it's more related to introduction of solid food. And when should we consider complementary food? So we talked about the balanced diet and the requirements. So most of these requirements are met from breastfeeding alone till the baby is 6 months of age or so. So the recommendation stands that exclusive breastfeeding is adequate till 6 months of age. There may be some situations where we may consider starting before 4 to 6 months of age, where there is faltering growth, where the baby has reflux, as mainly semi-solid food reflux is less. Work requirement of the mother, where she plans to give only exclusive breastfeeding with solids, she doesn't want to use formula, then we may consider earlier weaning. So studies have shown a possible increased risk of obesity if they start weaning early. This is before 3 months of age in a mixed or formula feeding group, and this is from the EAT study in the UK. So many studies have shown no significant difference between starting at 4 to 6 months. So whether you start at 4 months plus or after 6 months plus, there is no significant growth or nutritional endpoint difference. So the WHO, as we said earlier, recommends 6 months exclusive breastfeeding and starting complementary foods at 6 months of age. The ESPGAN, as well as the European Dietetics Association, as well as some other bodies, recommend not before 17 weeks, which is end of 4 months, but not later than 24 weeks, which is 6 months. We can consider introducing after 4 months if the infant shows signs of readiness, but you start with smaller quantities and the milk intake would not really change much. So your feeding pattern still stays mainly milk dependent, but you start introducing the baby, because the baby adapting to solids is a staged process. So it doesn't happen all at once. So the baby learns slowly. Starting prior to 4 months is not a good idea, because the baby is not ready. There is a higher risk of obesity and obviously higher risk of complications. We should start before 6 months of age, because if you delay it, there is a risk of iron and zinc deficiency. And as the baby gets more independent, there is a higher risk of rejection as well if you leave it for too long. So why should we introduce complementary food? So one issue is that the infants grow rapidly and their requirements increase. So milk alone is not able to meet these requirements. And as the infant grows older, milk is not an adequate source of iron, zinc, and other essential elements. Solids are more packed with energy and nutrients in smaller volume compared to liquids. The natural progression from milk to solid food in all mammalian species happens. This is related to their digestive ability progressing Fiber intake becomes essential because if you leave older kids on milk intake alone, they invariably get constipated. And there is ability to chew, and the developing teeth comes up as well. And giving more solids gives more satiety as well. So these are linked to the growth process. So we do need to progress with solid food unless it's unavoidable for different reasons. Delayed introduction may cause poor acceptance, as we said earlier. So how do we assess whether the baby is ready to take solid food? So the baby is expected to have a good head control, ability to sit with support, and they start demanding milk a little faster. So there is a shorter interval between the feeding. Their satiety is reducing. The baby starts opening the mouth when presented with food. There is a diminished extrusion reflex. So this is the reflex where the tongue rises and pushes against any object. So in the early months, this is quite active, but when the baby is ready for weaning, this becomes less prominent. The baby is showing interest in what a caregiver is eating. If you discuss with parents, many times they say that this is commonly noticed soon after 4 months. They also show cues that they're finishing feeding, such as turning away from the bottle when they're done. What should we do in premature babies? So many of us do deal with premature babies, and we go by the chronologic age in the premature babies. We don't need to wait for the corrected age of 6 months. However, you don't need to start them at 4 months. You can wait till 6 months of chronologic age. Many premature babies might have oral aversion, especially if they have been extreme preterm. They've stayed in the NICU for a prolonged duration of time. So if this is noted, obviously we have to be careful in our approach. We may need to involve a speech therapist early on, so this aversion doesn't cause further problems and picky eating later on. So in case of developmental delay, both in term and preterm babies, we have to individualize according to the developmental maturity of the child. So the signs of readiness, which we mentioned earlier, when the developmentally delayed child reaches those stages, we may have to start. And in some cases, we actually start considering a percutaneous gastrostomy to be able to feed their nutrition appropriately when they are not able to swallow the progressive food. So overnight continuous feeding and issues like that may be needed in babies who are not progressing well. So cerebral palsy, for example. So what foods to introduce? So the current dietary guidelines promote the intake of varied diet. We should be having healthy, nutrient-dense foods comprising a wide range of vegetables, fruits, cereals, preferably whole grains in terms of their dietary fiber intake. Lean proteins are important, and dairy products should be introduced. As the child grows, we may go for low-fat dairy products as well. Cultural factors play a role in determining what is chosen, and this should be respected as well, though we should guide them in terms of food groups which have certain nutrients which are important. It's often habits to start with a variety of single ingredient fruit, vegetables, grains, and meats in any order to allow for the baby to become accustomed to diverse flavors. We should avoid foods that are high in saturated fat, added sugars, and added salt. This could displace the intake of healthier alternatives and should be limited. There should be no honey because of the risk of infant botulism in the whole of the first year. And whole milk is also not recommended, partly because of the very high renal osmolar load from the high electrolyte content. The protein load is very high in cow's milk as well. And there is a higher chance of GI bleeding from these components. There is no added salt or sugar in the food as well till 1 year of age, though fruits can be used, and we can allow yogurt, cheese, and so on. No sweetened beverages, and fruit juice in general terms isn't ideal as well because of its effects on teething, and fresh fruit is better than fruit juice. We should avoid excess of rice-based weaning because arsenic load may be there depending on the source of the rice. Mix of cereals to manage that component. So oats, wheat, and other grains can be used along with rice. Avoid excess gluten load if you're introducing wheat after 6 months and not in high loads as well. Milk is a predominant food source in the first year, and we should still educate the parents on the need for a balanced diet. Avoid over-reliance on foods like potato. These are well tolerated and the children may like them, but the nutritional value is not very good. Avoid discretionary foods like biscuits, sweets, chips. These make the child happier, but they're not the healthy option. And sugary drinks should not be used even after 1 year of age, partly because extra sugar isn't good. We notice hyperactivity in the children with extra sugar intake, and it's obviously going to be damaging to the developing teeth as well at this stage. We should train the parents to really recognize food groups. So protein-rich foods, iron-rich foods, which foods are rich in fiber intake, and water intake should be stressed as well, because if you don't take adequate water when you're having introducing such foods, constipation may be a complication. The variety of foods consumed is also important, and individual foods within each food group can differ with respect to their nutritional profiles. So, for example, in the protein-rich group, poultry and meats provide rich sources of niacin and zinc. Seafoods are rich in omega-3 polyunsaturated fatty acids like the DHA and ECOS. Is the slide still seen? I lost the slides. Can you see my slides? Yeah. So meat, poultry, and seafoods are also rich forms of heme iron. The heme iron is more bioavailable than non-heme iron. So this is one issue we should look at vegetarians. So we'll come to that as well. So vegetarian foods lacks heme iron, it lacks DHA. So in terms of introducing allergenic foods, current evidence, there is no benefit from delaying the introduction of allergenic food. So this is mainly based on results from the LEAP study and the EAT study from UK. And in infants at high risk of allergy, introducing peanuts in age-appropriate form between 4 and 6 months showed a lower risk of allergy to peanuts. So delaying it doesn't help, and sometimes the risk of allergy may be more. Evidence similar to this is shown for other potentially allergenic foods like egg, fish, etc. And we can introduce allergenic foods in the culturally and age-appropriate form anytime after 4 to 6 months. So the key message here is that we don't really need to hold back allergenic food. Introduce them even at 4 months if you feel there is a higher risk of allergy. Age-appropriate form means like nuts should not be given as nuts. We should use a paste of them in the food. So what foods to introduce? So obviously protein-rich food like pureed meat, chicken can be introduced by 6 months and as early as 4 months if you're starting weaning early. Yogurt and cheese, which is a low-salt variety, ghee and butter can also be introduced by 6 months. However, whole-fat cow's milk should not be given at this age till 1 year of age, as we discussed earlier. So if you need to use milk for cooking purposes, you can use breast milk or formula milk. If milk is going to be fully cooked, some fresh milk is okay as well. If you are introducing eggs, it's better to introduce around 6 to 7 months of age, and raw egg should not be used, or partially cooked egg should not be used because there is a risk of salmonella introduction, and so it should be fully cooked eggs. Parents often ask about yellow yolk and white yolk. There is no real need to distinguish between them. However, because of the cultural issues, you can say start with the yellow yolk and go on to the white yolk in a week or so. In terms of fish intake, again, start with one species at a time. So seafood allergy is not uncommon at this stage, and so don't mix up species. And once you tolerate a certain species, you can go on to the next one. Same with other seafoods like lobsters and so on. The nut should be introduced in age-appropriate form, as we covered earlier. So in terms of vegetarians, I mean, I myself am a vegetarian, and we have to think carefully to get balanced diet. And protein intake is often lower because you don't take animal protein. Some of us don't take eggs as well. So you have to take extra soya, dairy foods, nuts, and pulses. Vegans have much more issues when the child is weaned, because if you stick with the vegan food, you do need definitely supplements. Suppose you are ovo-vegetarian or you're ovo-lacto-vegetarian, your protein intake and the B12 and other aspects are better than being a vegan. So we also have to look at the iron intake, zinc, calcium, vitamin B2 and B12, which also come from meat products, vitamin A and D if you don't take supplements, and DHA comes mainly from seafood, so you may be deficient on that as well. So it's very important that we look at these in vegetarians, and if you are having a vegan diet, definitely discuss with the dietitian to get the appropriate supplementation. Fiber is often ignored, and obviously many parents substitute milk when they don't eat solids, and the negative effect of this is obviously they are not going to get enough fiber. Adequate dietary fiber is important for the gut motility. So by giving fiber, we can avoid constipation, and the prebiotic effect of fibers has to be considered. So healthy gut microbiota development and maintenance depends on fiber intake. Fibers also improve the satiety as they are empty fillers. They don't get digested, they don't get absorbed, and we avoid overeating that way. The requirement of fiber can be expressed in terms of grams per 1000 kilocalorie intake, and usually it's 6 to 10 grams per 1000 kilocalories. There is an option to get dietary fiber if the child is refusing fiber in other foods like vegetables. You may add dietary fiber to reduce the risk of constipation. In addition to encouraging the intake of fruits, vegetables, and legumes, we should recommend nut butters, for example. And if you give the grains as whole grain, it's going to be having more fiber content. So coming on to some tips for parents, we should ensure adequate water intake when we give foods and increase the water intake if the stools are hard. Avoid juices, as fresh fruits in the mashed or pureed forms are more nutritious, they have more fiber content, and they retain more of their other benefits. Sucking fruit pulp through strainers is not encouraged, again, because it's a developing teeth, and the longer any food stays in contact with the teeth, it's not good for the baby. Focus on dental hygiene with attention to dental care from the early stages. Start reducing milk intake in balance and increase the solids as it goes on. So some baby-led weaning is to be encouraged. Some parents are fixated on baby-led weaning as a whole. This is a bit challenging, but obviously a baby-led component definitely adds flavor. It encourages the child's participation, helps them to progress better. So introduce foods like cooked carrot slices, cucumber slices, cheese slices at age-appropriate forms. And if you are going to give biscuits, for example, give age-appropriate biscuits. The normal biscuits we eat are not appropriate for the babies because they have the normal sugar, and processed foods are not good for the digestive system and encourage constipation. Remember that these foods like biscuits make them not to feel hunger, so this may lead to a cycle of picky eating. Avoid being too rigid, encourage experimentation, and avoid forcing to finish. We'll be mentioning these again with the picky eating. Avoid giving some texture, same texture. I mean, if you give ready-made foods every time, the texture of the food, the flavor of the food doesn't change at all because these are pre-packed and they have a consistent taste. But when we make at home, the taste keeps changing. So it's important that parents are encouraged to give different sources of food, not just outside ready-made food. Delaying introduction of granular or chopped food beyond 9 months may lead to reluctance to move beyond pureed food. So this is a common complaint. My baby doesn't want to take anything more than pureed food, and this happens because they have delayed introduction. So weaning advice should include all this at an earlier stage so we can avoid picky eating later on. Avoid compensating with milk. So many parents don't wait for the child to complete a meal, or they have picky eating children. They start giving milk instead of the solids, and this pattern doesn't change. So you have to stick with a consistent approach. Child may refuse in the beginning, but if you don't give in and give milk, they will still take the foods. Avoid food as a reward. This is applicable to any age. And eating together or sharing from your plate encourages them to try new textures and consistency. There are studies which have looked into the weaning pattern in infants, and FITS is Feeding Infants and Toddlers study done in the US. They did 2 stages, 2002 and 2008. In 2002 study, they looked up to 24 months of age, and they extended it up to 47 months in the 2008 study. The FITS 2002 study called attention to areas where improvements are needed. So we need more fruits and vegetables, fewer sweets, French fries, and fried potatoes in the infant's diet. And they started the Start Healthy feeding recommendations and consumer messages for parents, not only in the US, but this spread all over the world as a movement. And the 5-a-day portion of fruits, vegetables, and taking adequate milk in growing children, these came from this. The FITS 2008 started focusing more on obesity, as childhood obesity started becoming a very important public health concern. And the decision was made to extend it up to 4 years of age because the quality of food consumption declines from infancy through the preschool years, and this leads to a higher risk of obesity. So this is a critical age when dietary and physical activity patterns are forming. There is also the National Health and Nutrition Examination Survey in US, and this was in infants and toddlers till 2 years of age. So they showed that toddlers and preschoolers' intake of some nutrients are excessive, in fact, like sodium, folate, vitamin A, and zinc, and even iron, as well as saturated fat as a percentage of the total energy. They had recommended lower than recommended levels for fiber and potassium intake. So this indicates a need to monitor the intake of such nutrients, especially the fortified foods. For example, if iron goes high, it's not ideal as well. So we need caution in routine food fortification and nutrient supplementation, and this is another area to monitor. So the survey findings in US showed preschoolers' diets were low in fruits and vegetables. Discretionary calories were commonly consumed. I mean, even though we discourage parents to give them, it's often given as a reward, for example. And when they have older siblings and they see the older sibling consuming such food, it's not uncommon for them to demand this again. So French fries were the most common vegetable consumed, even though I said earlier that potato doesn't have much nutritional value. And 40 to 60% of the families had children consuming sugar sweetened beverages. Juices and sugary carbonated drinks were still commonly used, even though there is a lot of awareness campaigns going on. It was as high as 15 to 30% even in the first year of life, especially juices. And luckily, carbonated drinks are not that commonly given in the first year. After that, 30 to 50% rate after 1 year of age. So when we look at approach of the parents in terms of giving solids, so these are the various factors. The caregiver experience is based on cultural norms, the grandparents or the family friends' advice, as well as the healthcare physician's advice. And the infant behavior is decided by the two components and the approach of the parent. So whether it is a caregiver-oriented caregiver approach, which means they are more focused on what they think should be happening, or whether it is an infant-oriented caregiver approach where the infant gives cues and the parent adapts accordingly. So the infant-oriented behavior is obviously much better, and that's a responsive type of parenting that is more likely to reduce picky eating. There may also be a problem with differential interpretation of cues. So possible issues may happen when the mothers inaccurately interpret the infant cues. This happens even in exclusive breastfeeding or formula feeding in the beginning. However, an infant who is signaling overstimulation and becoming agitated may be interpreted as having hunger instead of just being given a quiet space. There is a frequent problem also with using cereal. So this study, the FIT study in US, showed that parents often put cereals in the bottle to reduce reflux, which is not routinely recommended. Of course, AR milks have thickeners in them, but putting cereals gives many more components. And early introduction of weaning food can be a problem as well. Many families were shown to introduce even before 4 months because of their grandparents' advice and so on. In terms of dietary supplements, so vitamin K at birth is given routinely, and if parents do not agree for that, we can give oral vitamin K as 2 milligram on day 1, 7, and 28. Vitamin D drops is usually started again soon after birth at 400 units per day. This applies both to breastfed and formula-fed babies, because if you need to give around 1 liter of formula milk to a baby to get the adequate supplement, so that reaches only by 4 months of age in most babies, and by that time they start weaning. So not to confuse it, give vitamin D for both breast and formula-fed babies. After 4 months, we consider a multivitamin which has vitamin D as well, and iron supplement should be started, especially in breastfed babies. In formula feeding babies, we can consider adding additional iron after 6 months if the dietary intake is not adequate. Culturally, many families from India, for example, don't start meat products till 1 year of age, so you do need to give iron supplements. So when introducing complementary foods, consider iron fortified or iron rich foods as well. So don't stick to one food type, but give variety. Consider DHA intake. The fluoride in diet and water should be considered, and the supplement should be given at least till 1 year of age, preferably till 2 years. The UK guidelines say you can consider giving it till 5 years. So leave it to the parental choice after 2 years of age, unless you have a definite ground for deficiency. Can I ask the chairman how much more time I have? Can you advise me on how much more time I have?
Dr. Samer, your mic is off, but I think Dr. Sridhar, you've got another 5 minutes.
Yeah, I think so, Dr. Sridhar.
Coming on to the last part, which is picky eating. So picky eating is also referred to fussy eating, and it's a complex behavior. It's broadly referring to a combination of different traits. So the traits characterizing picky eating can be food selectivity, where they avoid the intake of certain foods or food groups. Sensory sensitivity, this happens more often in the premature babies or babies who had severe reflux. So these babies avoid food based on the response of the oral area. If you bring a spoon to the mouth, they may start pushing it away and so on. There may be a lack of interest in eating, that is, they eat only small amounts and have a poor appetite. Eats less, that is related to the parents' perception. So this is a common problem. And food neophobia, where they don't want new foods introduced or they're reluctant to try new foods. So For a parent or caregiver, picky eating behavior is always worrisome, but however, the importance is to understand whether the perception of the parent as for picky eating is indeed associated with reduced diet variety and nutrient intake, and whether this has any implication on the child's nutritional status and growth. As a pediatrician, our responsibility lies in illustrating to the family whether the growth profile of the child is going appropriately or not. And picky eating can often be a result of the parents' pattern, the response of the parents to feeding behavior. And if the child is growing normally, it's less of a concern. If the child's growth trajectory is dropping, it's more of a concern. So this is what we should encourage. And as I said, the advice that we are discussing now should be given early in the weaning phase. So I always stress on holistic care, educating the families early on so they don't end up with problems. So infants like a degree of independence, and parents out of their concerns may try to force a pattern of feeding on the child that does not suit the child's personality. The infant responsive parenting styles are more likely to avoid picky eating. Majority of the picky eaters are created by parents' anxiety or over expectation, we can call that. So when we say that the parents are forcing the child to feed, it may just mean that they are trying to feed the baby when they are not hungry. They try to make them complete a quantity that they don't need. This is often a cultural thing as well. For example, in the subcontinent, we don't like to waste food, so we try to finish what we've taken. And trying to force a particular food type or texture. So remember that you may have an equally nutritious alternative option which a child will take. So it's not necessary to give a particular form of the food as long as the nutritional value is met. And there was a recent review by Samuels et al. And in this, about 14 studies, the average age of picky eating reference ranged from 4 months to 12 years. And the prevalence was very widely reported, from 6.6% to 60%. So you can see if you are stringent with the criteria, the incidence is less than 15%. And the more severe ones where nutritional needs are not met is only about 5%. So picky eating is a blown up topic. It doesn't really happen that often. As long as the counseling happens with the parents, it's less significant. So there is a varying impact on growth and micronutrient intake, but majority of the time it didn't affect important components. Overweight was definitely lower among the picky eaters, which is not a bad thing given that obesity is an increasing trend. A tendency to underweight was noted, though the proportion was less. Micronutrient intake, however, was still within the recommended allowance for most nutrients. Protein intake was lower in children who avoided meat, and refusal to eat vegetables and dietary fiber intake was lower in these cases. So these are the red flags that we should carefully look for if there is picky eating. So is there any signs of aspiration, difficulty in swallowing, vomiting or diarrhea, which may indicate allergy, failure to thrive, pain while feeding, inability to advance textures because of their sensory difficulties, whether the child is developmentally delayed or whether there is any other medical condition. The environmental red flags may mean parental behavior might need to change. So reported forced feeding, reported presence of distractions at meal times. This is very common. It's almost the norm that parents use TV. We have to start telling them about the negative effects of screen time from the beginning before they even start this habit. Reported increased stress levels at meal times, prolonged meal times, inability to advance textures, and absence of independent feeding at all. So some baby-led weaning, as I said, should be encouraged. And the third part is behavioral warning signs, where you have anticipatory gagging, food selectiveness, cessation of oral intake after a traumatic incident, extended periods of food refusal, inability to advance textures, and so on. So this group happens more as a result of the environmental red flags, the parents not realizing where to draw the line and where not to force their kids to eat. So this is a secondary effect of forced parenting. So when we approach picky eaters, most children with picky eating only need parental counseling and monitoring and support. An approach which is less controlling and more infant responsive is ideal. Educating parents early during the complementary feeding introduction is ideal. As I said, most of these arise from misperception. So explaining to them how to monitor the growth, explaining to them how to progress is very important. And consider supplements if they are picky eaters to avoid iron, zinc, vitamin D, and fiber deficiencies. High energy milks are a controversial topic, and as we are running out of time, I can't explain in much detail. However, you should only start high energy milks where you have a growth defect. So don't give high energy milk as a substitute, because that's going away from what the healthy eating pattern should be. If you do see a drop in percentile, if you do feel it's impossible to get the normal dietary requirements through healthy means, you may consider a high energy meal as a bridge. So milks like Pediasure or Infantrini are available, which have 100 calories per 100 ml. Infantrini is used till 18 months of age. Pediasure can be used beyond 1 year of age. These are having normal sugar as well, so we should make sure the dental hygiene is better. In the extremely stunted kids, high energy components like 150 kilocalories per 100 ml like Nutrini or Febrini can be considered, but forgive me for using these brands, but just to give you an idea of what is available. If you do start, you should use it for a short period of time. Remember to monitor for excessive weight gain and cut back when it is noted. Try to keep it only for the night milk feed, because you don't want it interfering with their appetite during the day, because high energy milks do reduce their appetite. So with this, I will conclude, and I thank you for your attention. I think we may have.
Thank you, Dr. Sridhar. I think I can select one question for the sake of time. There is one question about, can salt be added to vegetables or cereals?
Added salt is not encouraged in babies for two reasons. One is they still have a significant milk intake, and milk has enough sodium for their requirements. And as we know, excess sodium is not good for their long-term health from the blood pressure and other aspects, cardiovascular health point of view. The other point is that added salt is often misinterpreted as amount of salt that the family takes. So the babies don't have that strong a taste preference, and if you add very minimal quantities, it shouldn't be harmful, but what the minimum is depends on the family's perception. For example, Europeans add very little salt, while Asians add a lot of salt. So the small amount is going to be quite variable between countries. So better not to add salt at all. I would still stick with that till 1 year of age.
Okay, thank you, Dr. Sridhar.